Welcome to the 12th webinar in our Lunch, Learn and Dance Wellness webinar series, Radiation Safety Issues in PET-CT. My name is Lynn McDonald. Joining me in the chat room is Maria Costa and hopefully our manager in training, Tara Hargraves. Anastasia from Salem Dance Company will be leading us in dance beginning at 12:30 Eastern. Let's take a moment to go over the functionality of the Zoom webinar. The audio and video will be from the presenters only. We have found that although you can access the audio through the computer or telephone, the quality of sound tends to be better when listening from a computer. There is a chat feature where people can discuss. If you would like, take a moment now to say hello and where you're from. If you would have questions arriving from the content, please enter them under the Q&A section. As the webinar is only a half hour in length and is immediately followed by our dance session, time may not permit for me to answer them during the webinar. The answers will be posted on our website, along with a link to the video recording and a copy of the slides. This can be found under Education Webinars. I will be sending a confirmation of attendance email after the webinar and will include a link to that page with the communication. I will also include the topics covered and the length of time spent in the webinar, as some people have requested this to send to their professional association. Lastly, I have automatic closed captioning enabled in the slide presentation. If they're being blocked by your Zoom controls, you should be able to select a different way to view the webinar in Zoom, which makes them easier to see. We begin with a brief overview of the types of ionizing radiation related to PET-CT. This will lead into how it is regulated in Canada. We will then explain what a PET-CT procedure entails and why this leads to radiation safety concerns. From there, we will discuss what dose is and dose from PET-CT as compared to other sources. We will give a general overview of considerations for patient and staff radiation protection. I will then speak to a number of resources available to those wishing to know more about radiation protection in PET-CT and the Canada Safe Imaging Initiative. Our audience today has a wide level of training and experience, and our time is limited. To accommodate these two factors, what will be presented will be an overview on radiation safety considerations in PET-CT. Some concepts are simplified for general understanding. We had a question sent to us before the webinar to request that we ask people working in PET-CT what others are using for dose reduction and feedback on the PET Indigo system. We have posted this question in the Q&A section. If you would like to add to the conversation, please do so. I will compile the answers and provide them along with a resource page with links to relevant documents with more rigor and detail for those who require it in the follow-up email and on our website. Also today, we may have Dr. David Koff, the chair of Canada Safe Imaging, or other members of the organization drop by. If they do, they will introduce themselves in the chat room in order to discuss the initiative, which will be brought up near the end of the slideshow. I will also include information about CSI in the follow-up email and resource material. Radiation can simply be interpreted as a form of energy. All matter, whether at rest or in motion, has energy. An object can have potential energy due to its position. An object in motion possesses kinetic energy. With radiation, the energy can take the form of moving particles or bundles of pure energy. Either way, the important thing is that this energy can then be transferred to another material, which can be helpful or harmful. For example, doing work for us or harming our tissues. The type of radiation and its energy will affect how it interacts with matter. To understand how radiation interacts with matter, we first have to discuss what matter is made of. All matter is made of minuscule particles called atoms. Atoms in turn are made up of protons, neutrons, and electrons. Protons and neutrons make up the nucleus or center of the atom, and the electrons orbit the nucleus. Atoms commonly have as many protons, which are positively charged, as electrons, which are negatively charged. The positive and negative charges balance each other out, so atoms are electrically neutral. When radiation with high enough energy interacts with one of the orbiting electrons, it can transfer some or all of its energy to the electron, knocking it out of orbit. This leaves the atom with more positive charges than negative charges, resulting in a positively charged atom. The electron is now free and travels away from the atom. This process of knocking an electron out of orbit is called ionization. In other words, ionizing radiation is radiation which is energetic enough to remove electrons from an atom. There are two sources of ionizing radiation: radioactive atoms and man-made devices. We have already mentioned what atoms are. They have a nucleus made up of protons and neutrons and have electrons orbiting around the nucleus. Most atoms in nature have a stable nucleus. In other words, a nucleus which will stay intact forever. Some atoms, though, have an unstable nucleus, one that will emit radiation or energy to try to become stable. Examples of naturally occurring radioactive atoms include uranium, radium, and radon. We can also create radioactive atoms for medical purposes, such as fluorine-18 and technetium-99m. We can also build machines which produce ionizing radiation without the use of radioactive atoms. In this case, we are talking about X-ray units, which include CT scanners. There are three forms of nuclear particulate radiation: alpha, beta, and neutron. All are ionizing. There are three forms of ionizing electromagnetic radiation: high-frequency ultraviolet, gamma, and X-ray. Other webinars in the series, including Understanding Radiation, describe these. For the purposes of this webinar, we will focus on the forms of radiation involved in PET-CT: beta, gamma, and X-ray. Beta particles are extremely small, charged particles which are emitted from the nucleus of a radioactive atom in their attempt to reach a stable state. There are two kinds of beta radiation: positrons, which are positively charged, and electrons, which are negatively charged. Negative beta particles are exactly like electrons. Positive beta particles have the same mass as electrons, but their charge is positive rather than negative, exactly opposite to electrons. Positrons are the antimatter particles to electrons. Beta particles have a very small mass. Their mass is approximately 2,000 times smaller than a proton or a neutron. Beta particles can be ejected at a variety of different energies, with each isotope having a characteristic peak and energy range. Some isotopes which eject beta particles also produce gamma radiation. If you're familiar with the structure of the atom, you may be a bit confused. On the previous slide, it was stated that beta radiation was a positron or electron ejected from the nucleus of a radioactive atom in its attempt to become stable. But the nucleus of an atom only has protons or neutrons. The stability of a nucleus depends upon the ratio of protons to neutrons. When there is beta radiation, the ratio of protons to neutrons is changed while keeping the same number of particles in the nucleus. A positive beta particle is produced when a proton turns into a neutron. The positron carries away a tiny bit of mass and the positive charge, while a negative beta radiation happens when a neutron turns into a proton by ejecting a tiny bit of mass and negative charge, an electron. Common nuclides used in PET radiopharmaceuticals are all beta emitters, chosen because they emit positrons and have relatively short half-lives. The nuclides are attached to a biologically important molecule, which will concentrate in certain areas. The application is what determines which pharmaceutical is chosen. The most commonly used PET radiopharmaceutical is FDG, fluorodeoxyglucose, which uses radioactive fluorine-18 tagged to a glucose tracer. When beta particles pass through matter, X-rays can be produced. This is called Bremsstrahlung, which means breaking radiation. The higher the atomic number of the material it is passing through, the more Bremsstrahlung is produced. Gamma rays are emitted from the nuclei of radioactive atoms. The emission of a gamma ray is always preceded by either a beta or alpha decay. Gamma radiation is electromagnetic radiation, just like ordinary light. The energy of gamma radiation is much greater than that of ordinary light. X-rays are emitted when high-speed electrons are slowed down or change direction due to interacting with atoms in a target material. Although they come from different sources, they Both gamma and X-ray are high-frequency electromagnetic waves. Beta, gamma rays, and X-rays are ionizing radiation. But because gamma rays and X-rays are electromagnetic waves, which can also be considered streams of massless, uncharged particles, they are not easily shielded. They do not have a range. They can theoretically travel forever. As they pass through matter, their intensity is reduced. The properties of the type of radiation are an important consideration when selecting shielding. Because beta radiation is made of charged particles, it is easily shielded with plastic or aluminum. Choosing these lower density materials reduces the amount of bremsstrahlung produced. However, many beta emitters also emit gamma radiation, which requires high density shielding. In cases like these, the lower density shielding is used to absorb the energy of the beta with low bremsstrahlung production, and then high density shielding is used to attenuate the bremsstrahlung and gamma radiation. Now that we have covered the types of radiation involved in PET-CT scans and how they were shielded, we'll explain how this relates to the regulation of ionizing radiation. With respect to radiation, most X-ray equipment, including CT scanners, low energy particle accelerators less than 1 mega electron volt, and sources of non-ionizing radiation such as laser, UV, ultrasound, and noise fall under provincial or territorial jurisdiction. Naturally occurring radioactive material, or NORM, is also provincially and territorially regulated, excepting transport, import, and export, which are federally regulated. In a federally regulated workplace, all provincial or territorial responsibilities become the responsibility of the federal government. No matter the province or territory, federal government responsibilities include all aspects of nuclear energy. Legislation includes the Nuclear Safety and Control Act, the Nuclear Energy Act, the Nuclear Fuel Waste Act, the Nuclear Liability and Compensation Act, along with sections of the Environmental Protection Act of Canada and the Transportation of Dangerous Goods Act. The federal government also regulates aspects of ionizing and non-ionizing radiation through the Radiation Emitting Devices, or RED Act. Canada's nuclear regulator is the Canadian Nuclear Safety Commission, an independent administrative tribunal set up at arm's length from the federal government with no ties to the nuclear industry. The CNSC reports to Parliament through the Minister of Natural Resources. Its decisions are reviewable only by the Federal Court of Canada. Its mandate is to regulate the use of nuclear energy and materials to protect health, safety, and security and the environment, to implement Canada's international commitments on the peaceful use of nuclear energy, and to disseminate objective scientific, technical, and regulatory information to the public. The Commission has up to 7 appointed permanent members whose decisions are supported by more than 800 employees. The Commission makes its decisions transparently and provides extensive reasons for its decisions. The federal government regulates PET locations. There are currently 10 CNSC licensed PET facilities. The CNSC also regulates equipment related to PET systems, including calibrators and source holders. To understand why PET-CT is so highly regulated, but still used on patients, one must understand how it works and for what purposes it is used. First, we will look at each aspect separately. PET stands for positron emission tomography. It is able to show functional information, that is what is happening functionally in the body at a given time. This is done by tagging biologically important molecules with a tracer and seeing where they accumulate. These tracers need to be produced close to the location where they will be utilized because they have such short half-lives. The concentrations of the nuclide will show up as a hotspot on the image, but very little is shown in locations where the tracer does not accumulate, so there are few anatomical landmarks, making it difficult to know where the hotspot is with respect to the patient's body. CT, on the other hand, gives clear anatomical detail with much better resolution than PET. It gives a good dynamic range, able to image tissues from bone to lung. But a CT scan cannot distinguish between active and benign disease. In other words, it is not showing any functionality. PET-CT combines the functional information from the PET tracer with the anatomical detail of the CT scan. It gives accurate anatomical registration, yielding higher diagnostic accuracy of either imaging technique on its own. Due to the nature of a PET-CT procedure, there are more than one component which requires consideration for radiation protection. The cyclotron used to produce the radioisotope tracers for the radiopharmaceutical, which is a class 2 nuclear device, the radiopharmaceuticals themselves, which are unsealed nuclear sources, and the CT scanner, which is a high-dose X-ray machine due to it taking multiple scans in a short period of time. The cyclotron, a particle accelerator invented by Ernest O. Lawrence in 1932 and widely used from the 1930s to the 1950s. It consists of a pair of D-shaped sheet metal electrodes called Ds placed face-to-face inside a vacuum chamber between the poles of an electromagnet. An oscillating radio frequency voltage of several thousand volts is applied to the Ds. Atomic particles to be accelerated are released in the center. The magnetic field causes them to travel in a spiral path from the center to the rim of the Ds, being accelerated each time they pass from one electrode to the other. When the particle reaches the rim, they pass out of the Ds through a small gap and strike a target. In this diagram, the electromagnetic pole pieces are not shown full size. They must be at least as big as the Ds to create a uniform field. Although cyclotrons are not as commonly found today, they are still used in the production of short-lived medical isotopes due to their relatively compact nature. As the ones used to produce medical isotopes are a source of ionizing radiation over 1 megaelectron-volt in energy, they are federally regulated. The IAEA maintains a database of cyclotrons in use for radionuclide production. According to their data, Canada has 28 cyclotrons in use for this purpose. PET radionuclides are positron emitters. A PET scanner can detect beta particles, Bremsstrahlung, which is not considered insignificant, and annihilation gammas, a pair of identical gammas produced when a positron and electron annihilate one another, which travel directly opposite one another. The gammas produced during annihilation are different from traditionally defined gamma in that they are not produced in the nucleus and are not monoenergetic. Most detection systems detect 511 kiloelectron-volt gammas. To do this, scanner detector blocks are arranged in a ring formation. The detectors detect when the signature pair of photons arrive and use these to create the hotspot image. Noise occurs due to the scatter of a photon off tissues in the body, changing the path of one of the photons, and random coincidence of 2 photons from 2 different annihilation events arriving at the same time. Scatter is patient dependent and can be corrected using the CT data. Randoms can actually exceed the number of true events. They are corrected by reducing the amount of time in the coincidence window and measuring randoms and removing them using a delayed coincidence window. It is important to improve the signal to noise ratio by removing as many randoms and scatters as possible in order to get good quality images, as it lowers dose by removing the need for repeat scans. Computed tomography, or CT imaging, provides high-quality images which reproduce transverse cross-sections of the body. The CT uses a rotating X-ray tube with the beam in the form of a thin slice, about 1 to 10 millimeters. The image is simply an array of X-ray intensity, and many hundreds of these are used to make the CT images, which is a slice through the patient. The technique offers improved low contrast resolution for better visualization of soft tissue, but with relatively high absorbed radiation dose. The CT scan is not only used to help locate the hotspot, but to improve the image. For example, they can measure the attenuation of X-rays in the patient and use that information to improve the PET scan. A PET CT scanner combines these 2 technologies into one machine. In a slip ring CT, most of the electronics are placed in the rotating gantry. This permits for helical scanning. PET CT scanners use a helical or spiral scan principle. If the X-ray tube can rotate constantly, the patient can then be moved continuously through the beam, making the examination much faster. The scanning process is shown. A CT scanogram performed first, followed by a full CT. Then the patient is moved further into the scanner for the PET scan. The pitch is the ratio of the distance the table travels per rotation to the X-ray beam width. By increasing the pitch, the dose to the patient can be lowered. When speaking to radiation protection and PET-CT, one must understand the different categories of health effects and the concept of dose. For more information, please see the webinar on health effects of exposure to radiation. We will do a quick synopsis. There are two types of health effects caused by ionizing radiation: stochastic effects and deterministic effects, also called tissue reactions. A stochastic effect is one that is applied to an increased risk of an outcome occurring. It is not going to happen with certainty. Radiation exposure increases the likelihood of developing cancer. With stochastic effects, the larger the exposure, the greater the chance the effect will occur. One familiar example of a stochastic effect is the connection between smoking and lung cancer. Smoking increases the risk of lung cancer, but not everyone who smokes will get lung cancer, and not everyone who has lung cancer smokes. The risk of developing a fatal cancer as a result of an exposure to radiation is approximately 4% per 1,000 millisieverts. Consider a person who worked for 50 years and received 20 millisieverts per year. This person's lifetime radiation dose is 1,000 millisieverts. This person will have an extra 4% chance of developing a fatal cancer. We are all constantly exposed to some form of radiation or another. We are continually exposed to high energy radiation from outer space called cosmic radiation. We are also exposed from the radiation emitted from naturally occurring radionuclides in the Earth. We also intake trace amounts of radionuclides from the air we breathe, the water we drink, and the food we eat. This background radiation exposure gives Canadians approximately 2 to 4 millisieverts of ionizing radiation dose per year. Here are some exposures which might typically occur to an average Canadian. Recipients of medical radiation doses are not subject to the regulatory exposure limits a worker would have, as it is up to the medical practitioner to balance the risks associated with the procedure with the need for imaging and treatment. As you can see, a PET-CT procedure provides a considerable dose compared to natural background radiation, but is much lower than where you would start to see deterministic effects other than cataracts. However, the dose is still not zero. One might ask why a doctor would choose to use PET-CT when it does have a relatively high dose. The answer is that it is most often used to diagnose and monitor health issues with a high risk of death if not treated. For example, cancer. The patient who gets PET-CT are on average around 60 years old. The risk of inducing a cancer due to the PET-CT scan is much lower than the risk of death from the condition due to the stochastic nature and latency of cancer. That being said, it is still important to keep the dose as low as reasonably achievable. Acute exposure is a high dose delivered within seconds, minutes, or days. Acute exposures are uncommon, but can still occur in the event of an accident or if radiation safety procedures are not followed. Deterministic or tissue effects are those which will occur if exposure is over a threshold dose. These include cataracts, blood changes, nausea, diarrhea, hair loss, skin damage, and death. When discussing deterministic effects, doses are typically reported in gray or milligray. Radiation doses leading to illness or death would only occur in the event of a severe accident involving a very large source of radiation. As indicated, other than cataracts, deterministic or tissue effects are not generally observed below an acute dose of 250 milligray. Changes in the blood counts will occur at a dose of the 250 milligray. Damage to the skin and hair loss can occur at 3 to 5 gray. Acute doses of 3.5 to 5 gray can result in sterility. Acute doses of 0.5 gray can cause nausea, vomiting, and diarrhea. Over the last decade, new research has shown that the threshold dose for the formation of cataracts is around 500 milligray. As this is lower than previously thought, The International Commission on Radiological Protection, or ICRP, is currently recommending a dose limit for the lens of the eye of 20 millisieverts in a year, on average over 5 years, with no single year exceeding 50 millisieverts. The CNSC has lowered the annual dose limit for the lens of the eye to 50 millisieverts per year. Each province has its own limits for exposure to X-ray radiation. For example, Ontario's limit for the lens of the eye is currently set to 150 millisieverts per year for X-ray workers and 50 for other workers. PET-CT is of particular concern in radiation protection due to it being a hybrid of both nuclear medicine and radiology. On their own, each requires staff who are well trained in a specialized area of imaging, and these are typically regulated by a different governing body. When you combine the two, whether it be a technician, an orderly, a nurse, or a doctor, the staff must be knowledgeable in both areas, not only in terms of their job function, but also in terms of radiation protection. PET-CT involves open nuclear sources, nuclear devices, and X-ray equipment, each which have different considerations for radiation protection. The tracers used in PET typically give more dose than those in traditional nuclear medicine, and CT scans have more dose than traditional X-ray. To cover all aspects of radiation protection for PET-CT would take significantly more than a half hour. I will quickly give an overview of general principles and then point to resources. All CNSC licensed facilities will have a radiation protection program implemented by a radiation safety officer. Workers should be able to access a copy of the radiation protection manual or some version of it related to their job function. The CNSC expects the doses to workers to be kept as low as reasonably achievable, not just under a certain limit. This is called the ALARA principle. To do this, procedures are written to keep as much contamination as possible out of anyone who is not the patient. For external radiation, the time spent near the source of radiation must be kept as small as possible, the distance from the source must be kept as large as possible, and the shielding should be used to absorb as much radiation energy as possible. Engineering and administrative controls, as well as standard operating and emergency procedures, must be developed before receiving a license. Dosimetry should be used for designated staff to determine doses. Staff should be properly trained in radiation protection as it pertains to their job function. There should be regular inspections to ensure the radiation protection program is being followed, and any discrepancies should be thoroughly investigated. Records must be kept. Of special consideration are female workers who may be pregnant and children, as health effects of radiation are more impactful on a fetus or child. The CNSC provides information to both the public and people working with nuclear sources and radiation devices to support the safe use of nuclear substances and radiation devices. These include technical information and infographics, guidance documents, for example, the radionuclide information booklet and design guide for nuclear substance laboratories and nuclear medicine rooms, and regulatory documents, such as those for developing and implementing a radiation protection program, and license application guides for certification of equipment, facilities licenses, and licenses for nuclear substances and radiation devices. The doses of ionizing radiation in medical imaging have been increasing as CT and nuclear medicine technologies become available around the globe. The International Society of Radiology, or ISR, is a non-governmental organization in official relation with the World Health Organization. It is a federation of the world's national radiological societies with a mission to facilitate the global endeavors of the ISR's member organizations in order to improve patient care and population health through diagnostic medical imaging and image-guided interventions. They are home to the ISR Quality and Safety Alliance, the ISR-QSA. The ISR-QSA acts as a convener and facilitator for continental, regional, and national quality and safety campaigns in radiation protection and drives the ISR's quality and safety agenda, including the Bonn Call for Action. The Bonn Call for Action seeks to foster coordinated work to address issues arising in radiation protection and medicine. It was issued at an IAEA organized and World Health Organization and Pan American Health Organization co-sponsored international conference held in Bonn, Germany in 2012, and strengthened at the follow-up conference in Vienna, Austria in 2017. Numerous stakeholder groups and countries signed on to implement the Bonn Call for Action. Sorry, I'm running a little over time. As a result of the Bonn Call to Action, a number of safe imaging organizations are at various stages of development around the world. These organizations, which are members of the ISR/QSA, provide information and support on best practices in imaging with respect to radiation safety. The Bonn Call to Action is an important initiative because medical uses of radiation typically require the physician to balance the need for imaging with the need to keep doses low, rather than having set regulatory limits. Also, radiation dose arising from the medical uses has increased as new technologies have been developed. Information for the public and for practitioners are available on the websites of these safe imaging organizations. For example, on the Image Wisely site, they outline optimization of the utilization of FDG in PET-CT. Canada is in the process of developing its response to the Bonn Call for Action. Canada Safe Imaging is a campaign to bring together stakeholders to strengthen medical radiation protection across Canada. If you would like to become a member of the initiative, there is a link to the stakeholder registration portal on their website, found at canadasafeimaging.ca. Currently in the chat room, I think Dr. David Koff is there for you to speak to, and we can put you in touch with Canada Safe Imaging as well if you email. The International Atomic Energy Agency, or IAEA, is widely known as the world's Atoms for Peace and Development organization. They provide a wide range of information, including scientific and technical publications, general interest material, and a number of information systems and data services, an information library, and software packages. I'll quickly run through what they have in terms of PET-CT. With respect to PET-CT, the IAEA has a number of relevant resources. They include the International Basic Safety Standards, strategies for clinical implementation and quality management of PET tracers, and Safety Report Series number 58. They also publish update papers between major publications. A number of the IAEA's Human Health series are relevant to clinical PET-CT. They have relevant publications in this series on quality assurance, appropriate use, planning a center, standard operating procedures, an atlas on quality control, a clinical atlas, and a nuclear medicine resource manual. They also have pocket guides for emergency situations, including for medical management of persons internally contaminated, and to support response to a nuclear or radiological emergency. They have a radioisotope and pharmaceutical series. Two examples are those for emerging positron emitters and guidance on facility design. The IAEA also has technical documents such as those for radioisotope handling facilities and a guide to clinical PET in oncology. Finally, they have a technical report series, which includes information such as physical characteristics and production methods and guidelines for setting up a facility. I'd like to thank my co-workers, Tara and Maria, for being here today, and also for Dr. David Koff for coming in. We have to move on to our dance session. I see that Anastasia is here waiting for me to turn it over. So thank you again. If you have any questions, you can always email us at info@radiationsafety.ca, call us toll free at 1-800-263-5803, or visit our website at www.radiationsafety.ca, or find us on Facebook. And it can be with anything to do with radiation safety, not just about medical uses of radiation. Thank you.
To register, go to www.radiationsafety.ca/services/webinars.